this is kind of how a lot of us have made curriculum before with these steps. And like, we are pretty advanced, so we inserted our thoughts on evaluation early. However, it is not common amongst a lot of other educators who create these lofty goals and objectives, who then like may not know how to implement it because they didn't do an adequate needs assessment at the beginning, and then don't know how to study it. You know, we asked, you know, now we have this program, how do we prove it? And that's because these last steps are often an afterthought. You know, you put the curriculum and now it's like, I need to prove it and I need to publish it and stuff like that. So I want to bring up another alternative way for curricular design that Brad's going to discuss called backwards design. And we'll leave you with that as food for thought. And he'll use the STEMI example as well.
All right, so this is a great opportunity to look at it in a room full of experts or folks that are pretty good at this. The backwards design can help you solve some problems, and so we're going to talk about that. So this is the structure of the backward design, and it really starts with the why, with the what is it that you want to have done? How will you know that you've done it? What are the results? And so we just work backwards. So we've got the results that we're looking for, and then, so the next step then, all right, so with looking at our STEMI stuff, we recognize that one of the things that we're noticing is that people are missing the effects of intracranial blood, and they're calling STEMIs for folks that come in with subarachnoid hemorrhages. And so that is, our goal is to eliminate that. So we come in right away with that as our goal. We recognize that that's the problem. And so again, we hit on Miller's pyramid earlier, or Miller's prism. We're impacting things with the backward design at the does level, at the shows or does. So our goal is to get the residents to think about, is this a subarachnoid hemorrhage when they are looking at a STEMI EKG? So that's our known outcome. So then the next thing we'll do is, how do we determine that they're able to do that? And so one way to do that would be to have a SIM with a subarachnoid hemorrhage patient and have them recognize that the STEMI on the EKG is not a STEMI, and that it's from the rest of the case. The rest of the case builds up to present it as a subarachnoid. So they're unconscious, or they've sudden thunderclap headache. And so then you'll go farther backwards. And so how are we going to get them to experience that, or to be exposed to it? And so it may just be that the pre-reading includes a case report of a subarachnoid that demonstrates a STEMI. So it may be as simple as having a reading in their pre-work, so that we know that our end goal is that they include subarachnoid in the STEMI diagnosis. So with this, the content is tight and focused. This may take, 30 seconds in the curriculum of your whole STEMI activation process, but it's a clear and defined outcome that you aim for, rather than starting with the beginning in mind. You're really starting with the end in mind. Any questions about that? So 3 steps. It really works best, like I said, with a clear outcome. The downside to backwards design is that it doesn't lead typically to mastery or to a broad depth of knowledge. It's really focused on just a problem that you're going to solve.